Good morning, everyone. Again, my name is Lee Green. Like Tad, I'm also a licensed insurance agent here in Texas. I'm certified in Medicare, which means I literally have to sit at my kitchen table every summer and take exams from every carrier, whether it's Blue Cross, Aetna, United Healthcare, Baylor, Scott and White, et cetera. I have to score 90% in order to continue representing Medicare products. So I've been doing this about 7 years. I had a long career in the healthcare industry, doing something similar to Tad for a long time. And for the last 7 years, I've been a what's called an independent Medicare agent here in Texas, which simply means I work with all carriers, all products. So our agenda today is basically just to give you about a 20-minute overview on the Medicare program, how it works, what does it cost, how do I sign up, what does it cover, and what are my options if I'm still actively at work. And so I think that should cover most of the questions from a high level. As Tad mentioned, I'm always available to talk with all of you and your employees. Should they be approaching age 65, the Medicare eligibility age, and they're trying to figure out, what's best for me? Is there a penalty if I don't sign up now? Am I better off staying with the employer plan? Is Medicare a better deal for me? And I will tell you that that really depends on each person's situation. Let me share my screen just for a second. I'm going to give you my contact information. Just in case you want to follow up with me, there's my phone number and my email address. Of course, you can get it from Tad or Lori. They'll be happy to share that with you as well. Again, there's no fee for my service. If I advise you, I get compensated by the insurance companies to be their agent in the field regarding Medicare, and the prices for all these different options, whether it's a Medicare supplement or Medicare Advantage or prescription drug, they're all set. It's not like another Medicare agent's gonna get you a better deal. I just know how they all work, and I've helped lots of people here in Texas over the last 7 years figure out what can be a confusing situation. All right, with that, let's jump into it. Hold on one second. Let me just set this up here. Okay. So we're going to do about a 20-minute presentation on the highlights of Medicare. I think you all should be able to see the green slide on the screen. You're going to hear about part A, B, C, and D. And so I will simply describe what that means. And I'll just jump right into it. So when people turn 65, they're eligible for Medicare. By the way, Medicare is run by the Social Security Administration. So when people are signing up for Medicare, they're actually interacting with the Social Security Administration in order to get enrolled in Medicare A and B. And I'll talk about the 4 letters in just a second. You can enroll in Medicare at age 65, or you can be eligible for Medicare prior to age 65. There's a few exceptions. If you're on Social Security disability for 2 years at any age, you can get on Medicare. You could be 30 years old, and if you've been on Social Security disability for 2 years, maybe someone was in a car accident and they're disabled, then they could qualify for Medicare at age 30. If you have ALS, Lou Gehrig's disease, at any age, you can qualify for Medicare. Or if you have kidney failure, end-stage renal disease. Those are the 3 exceptions where people can sign up for Medicare prior to the age of 65. Everybody else in the United States has to wait until age 65. And by the way, you're eligible for Medicare if you are a US citizen, or if you have a green card, a permanent resident card, and you've been in the US for 5 years prior to your 65th birthday. So if you just moved to the US a year ago from England and you have a green card, you wouldn't be eligible for 4 more years. So you have to be here at least 5 years prior to Medicare age eligibility. If someone, typically, if you have 40 quarters of work in your career, you're eligible for Medicare at a much lower cost. If you don't, let's say one spouse is working, the other spouse is home raising the family, then the spouse that's home can qualify for Medicare based on their spouse's work record. So my wife had like 36 quarters instead of 40. She qualified for Medicare at age 65, same cost as me, by applying based on my work record. These are some of the nuances that I'd go over with you or your employees given their situation. So Medicare A and B, that's known as Original Medicare. Think of it as Part A pays part of the hospital bill, Part B pays the doctor bill. So they work together. Medicare A and B only covers 80% of the doctor bill. They don't cover 100%. A lot of people think, oh, I sign up for Medicare, it's going to pay for everything. Well, you have to get either a Medicare Advantage plan or a Medicare supplement and drug plan. So those are known as Part C and D, and I will cover them in the next 20 minutes. So Part A and B is known as Original Medicare. When people sign up for Medicare, they'll get a red, white, and blue Medicare card. It'll say Part A, hospital insurance, Part B, medical insurance. If someone is already getting Social Security retirement checks, because you can sign up for Social Security at age 62, although your check's going to be smaller, but you're eligible to get Social Security beginning at age 62. So if you're on Social Security at 65, they will automatically enroll you in Medicare A and B and send you your card 3 months prior to when you turn 65. Medicare always starts on the first day of the month that you turn 65. So if you turn 65 April 18th, your Medicare would start April 1st. If you're not getting if you're not getting Social Security yet, you decided to put it off till your full retirement age, or sometimes you can wait until you're 70 and you can get a bigger check each month. If you're not getting Social Security, then you have to sign up for Medicare A and B if you would like to have it at age 65. And I'll talk about a situation where you might want to delay. But basically, it's real easy to sign up for Medicare. You just go on the Social Security website, you log into your personal account, like I would log in as Lee Green, put in my user ID and my password. There'll be a link right there on your homepage that says, click here to sign up for Medicare. They'll ask you 10 questions, name, address, date of birth. It'll say, do you want Part A? You say yes. Do you want Part B? You say yes. If you want Social Security, you can say yes. If you want to hold off on getting your Social Security check, that's fine. You can say no, no problem. And you click apply now. And about 4 weeks later, they will mail you your Medicare card, a confirmation letter, and they'll even post a benefit verification letter on your personal Social Security site that'll have your Medicare number and all the good stuff. So that's Medicare A and B, known as Original Medicare. C and D, because they're 4 letters, A, B, C, and D. Part C is the Medicare Advantage plans, typically the HMOs or the PPOs. I'll talk about them in a second. And the Part D stands for the prescription drug benefit. So a Part C Medicare Advantage plan is something that you would add from a private insurance company, such as Baylor Scott & White, Aetna, Humana, United Healthcare, Blue Cross. They all offer Medicare Advantage plans. A Medicare Advantage plan is another way for you to get all your Medicare benefits. Because remember, I told you that Medicare A and B only covers 80% of your bill. So people are like, I don't want to be on the hook for 20% of an unlimited doctor bill. Because when I meet with people and if I ask them, what do you currently have? And they say, I have Medicare A and B, and I say, do you have anything else? And if they say, no, I just have Medicare A and B, why am I getting doctor bills for 20% of every service? I'm like, because Medicare only covers 80%. That's why everyone in the United States who's on Medicare either signs up for a Medicare Advantage plan, or you'll hear about a Medicare supplement or Medigap. It means the same thing, as to cover the other 20%. Now, the Medicare Advantage plans, they cover everything that Part A and Part B cover: hospital, medical, surgical. They include the drug benefit, and they have a lot of bonus benefits that you see: TV ads, direct mail. I'm sure you're getting telemarketing calls. The Medicare Advantage plans have a really attractive bonus package, like they include dental, vision, hearing, free gym memberships, a quarterly over-the-counter debit card. Many of the Medicare Advantage plans have a 0 monthly premium. In other words, you could sign up for a Baylor Scott and White, Humana, United Medicare Advantage plan, and you'd have no monthly premium. That's because for everybody that signs up for an Advantage plan, that plan is responsible for providing you with all of your Medicare benefits. They pay the doctors, and they take the financial risk. In exchange for that, Medicare would send that insurance company, say it's Baylor Scott and White, they might send them a check for $15,000 a year to cover your doctor bills, whether you go to the doctor or not. So you might go 2 times a year, or you might be going 6 times a month. You know, they're getting that $15,000 a year approximately, and they don't have to charge you a monthly premium. And the average Medicare person might only spend $9,000 to $10,000 a year. So the Medicare Advantage plans are doing very well with this arrangement. In order to sign up for an Advantage plan, you have to have Part A and B. So the only thing that someone turning 65 who wants to go on Medicare, the only thing they need to do is just sign up for Part A and B, and that takes about 10 minutes. And you can do it online. You can go into your local Social Security office. That's all you need to do. And then an agent like myself would help you decide what's the most appropriate Medicare Advantage plan, prescription drug benefit, Medicare supplement plan, based on your situation. Probably the most important thing you'll learn from this presentation, let me just show you something here. These are the 2 options that people have once they have Medicare A and B. They can either get a supplement to pick up the other 20% and a separate prescription drug plan, or they can get a Medicare Advantage plan, which typically includes the prescription drug and all the bonus benefits like dental, vision, and hearing. You don't have both. You know, you would have either an Advantage plan or a supplement and drug plan. Medicare, by the way, Part A does not cost anything, and Part B starts at $164.90 a month. It is based on your income bracket. So they look at your tax return every year from 2 years ago. So if you're turning 65 this year, they're going to look at your 2021 return. And if you're in a high income bracket, like let's say you and your spouse made more than $200,000 a year in 2021, instead of paying $164 a month, you might pay $238 or $300, depending on what your income bracket was 2 years ago. And they look at that every year. So if your income fluctuates, your Medicare Part B premium might go up or down for the following year based on your income bracket. I know that's a little confusing, but that's why I'm available to talk with people about their situation. Okay, let me go back to this for a second. Again, in order to enroll in a 0 premium Advantage plan, you have to have A and B, and the Advantage plans are based on what county you live in. So a certain Advantage plan might be offered in Bell County, McLennan County, Lampasas, Williamson, etc. So if you're living in Dallas, you'll need to get a plan that's offered in Dallas or Tarrant or Rockwall County, for example. You wouldn't be signing up for an Advantage plan that's offered in Temple, Texas, because the Advantage plans have a network of doctors and hospitals that essentially they want you to use. And so that's why you have to live in that area. So I'll go over that in just a few minutes. Medicare is a federal health insurance program. It's separate from Medicaid. Medicare is federal. Medicaid is run by the state of Texas. Some people qualify for both. That's a separate conversation that we would have. As I mentioned before, can you rely on just Part A and B? If you do, you're going to have a deductible and you're going to be paying 20% of your doctor visits and outpatient services. I do not recommend that people just have Medicare A and B. I mean, what happens if you have open heart surgery and your cardiovascular surgeon's bill is $100,000? And if all you have is Medicare A and B, you're going to get a bill for 20% or $20,000. If you have a Medicare Advantage plan or a supplement, as Tad pointed out at the beginning of the presentation, you may owe nothing on that particular surgery. That's why it's good to get some guidance from a Medicare agent. So I mentioned that the Medicare Part C plans cover everything that Part A and Part B cover. You'd still have to pay the $164.90 a month to Social Security for Part A and B. And if you're getting a Social Security check, they will just deduct that Medicare premium from your monthly Social Security check. If you're not getting a Social Security check yet, they will bill you quarterly, and they'll give you the option to set up monthly automatic bank draft, but they'll bill you for your Part B premium. So even if you sign up for a Medicare Advantage plan that has a zero premium, you still have to pay the $164.90 for Part B. Remember, Part A you don't have to pay for because they've been taking money out of your paycheck for your entire career. But Part B you do have to pay for. The Medicare Advantage plans, they have networks that they work with, doctors, hospitals, etc. They often have co-pays for various services. So you might have a zero premium and you might have no copay for a primary care visit, but with an Advantage plan, you might pay $25 when you see a specialist, $150 for an outpatient procedure like hip replacement or cataracts, maybe $250 for an MRI or a CAT scan. And the Advantage plans, they have an annual out-of-pocket max, a yearly limit on your out-of-pocket costs for covered medical services. So for example, let's say you're on an Advantage plan and the out-of-pocket limit is $5,000 a year. So let's say you were to have a gazillion office visits, you were in the hospital, you had MRIs, you were going through some chemo, and then you called me up in the middle of the year and you said, hey, Lee, I think I've hit my out-of-pocket maximum of $5,000. What happens now? I'd say, well, you've hit the yearly limit on out-of-pocket costs. So with your Advantage plan, you're now covered 100% for all Medicare Part A and Part B services, medical, hospital, surgical, for the rest of the calendar year. So with an Advantage plan, you're never going to owe $100,000. Worst case scenario, you might hit that out-of-pocket maximum. Okay, so what are the options that people have? So some of the questions to consider, how much can I afford, in terms of my Advantage plan or my supplement? Does it cover the services I need? Some people call me up and they say, I'm a diabetic, or I'm going through cancer treatment, or I spend 3 months out of the year in Arizona. I need to make sure I'm covered wherever I am. These are conversations that we need to have. And I will caution you, a lot of people, when they go on Medicare, they'll ask their friends or their neighbors or other family members, hey, what should I do? What should I sign up with? And that's okay. It's good to get input. You just have to be careful because people are going to give you advice based on their personal situation. They may not know anything about your medical situation. They may not know that you're a diabetic, or that you're going through chemotherapy, or that you have a hip replacement procedure coming up, or that you travel, et cetera, or that you're still working and you have employer coverage. So these are some of the situations where, when I talk to people, the first thing I say is, fill me in on your current situation. Are you working? Have you turned 65 yet? Do you travel? Those types of things. And then we can zero in on what makes the most sense for you. Obviously, one of the most important questions is, can I see the doctors that I want? That's another question I ask people. Where do you go to the doctor? And how, do you have to have those doctors? Are you flexible if there's perhaps a better Medicare plan for you? And so that's a very personal conversation that we have. So I talked about the two options that people have if they are going on Medicare. They can either have Part A and B and a supplement. Basically, with option one, Medicare pays 80%, the supplement pays 20%. You might have a $226 deductible for the calendar year, and then you're covered 100%, and you can go wherever you want. With option one, there's no network restrictions. You can literally see any doctor or hospital in the United States that treats Medicare patients, which is virtually all of them. And then you'd get a separate prescription drug plan, because Medicare Part A and B don't cover prescriptions at Walgreens or CVS or HEB. So people get what's called a Part D drug plan. With a supplement, Medicare pays 80%, they pay 20%. The supplements are based on your age, gender, zip code, whether you smoke or not. They're going to run you about $100 to $120 a month for a supplement policy, regardless of whether you go with Blue Cross, United Healthcare, Aetna, Mutual of Omaha, et cetera. And if you sign up for a supplement when you're first eligible, they're not allowed to ask you any health questions. You're automatically approved. There's no pre-existing condition limitations. You could literally have a hip replacement on day one and it would be covered 100%. You could be going through cancer treatment. It would be covered 100%. Same thing with the Medicare Advantage plans. If you sign up for a zero premium Advantage plan, which includes the drug benefit, dental, vision, and hearing, they're not allowed to exclude any medical services as well. Very important. The Advantage plans come in two flavors. You often hear about HMOs and PPOs. Basically, with a Medicare Advantage HMO, you have to use doctors in the network. Your primary care doctor may need to refer you to a specialist. You're basically using that network of doctors and hospitals. If you choose a PPO, you can use doctors that are in the network or out of the network. But often, if you go out of network, you're going to pay a higher share of the costs. The HMOs, by agreeing to stay in network, typically have richer benefits. They have a better dental benefit, better vision, hearing, over-the-counter card, and lower copays. The PPOs, they may have higher copays. The benefits may not be quite as rich, but you do have the flexibility to go in and out of network. I realize a couple people have joined this presentation a little late. Tad Doro and Lori over at BKCW are recording this, so they'll be sending out or making available a recording if you want to hear the first 20 or 25 minutes that you may have missed. So, these are some of the deductibles and co-payments that, you have with Medicare A and B. This is why people need either a Medicare Advantage plan or a Medicare supplement. So you're not on the hook for these deductibles and, the 20% co-insurance when you go to the doctor or hospital. I mentioned that the Advantage plans, they really sweeten the pot. I mean, they'll throw in dental, hearing exams, help with hearing aids, glasses, prescriptions, emergency care, anywhere in the US or outside of the country. So even if you're in a Medicare Advantage HMO and you're traveling in Colorado or Florida or Arizona, if you were to get a chest pains or food poisoning or the flu, you could go to the nearest doctor or hospital and you would simply have the emergency room copay, maybe 90 bucks. You might get you'll get an over-the-counter card maybe for 30, 40, $50 a quarter with an Advantage plan to get wellness products like vitamins, Ace bandages, Bengay, things like that. So it's a nice thing. Let's look at prescription drugs. A lot of people often get confused about the Medicare drug plan. So if you have Medicare A and B and you have a Medicare supplement, you can get what's called a standalone drug plan. There's about 25 of them offered in Texas. They all cover about 4,000 drugs. They all negotiate and work with many of your familiar area pharmacies, CVS, HEB, Walgreens, Sam's Club, Costco, Walmart, etc. And they might run and cost from $6 a month up to about $30 as a monthly premium for option one, a standalone drug plan that is coupled with a Medicare supplement policy. If you get a Medicare Advantage plan instead of a supplement, the drug benefit is included. You do not have to pay a separate monthly premium for that drug benefit. Think of the Advantage plan as a package deal because it covers all your Medicare benefits. It's got prescription drug coverage. Granted, there may be copays if you have certain brand name or specialty drugs. And the Advantage plans have the bonus benefits like dental, vision, and hearing. The Advantage plans typically have 4 stages. The drug benefit, either whether it's a standalone drug plan or if it's packaged with the Advantage plan. So you might have a deductible for brand name drugs that you have to meet. There's typically no deductible for generic drugs like cholesterol, blood pressure, thyroid, certain metformin like for diabetes. And oftentimes for those generic drugs, your copay might be $0 or $5 a month for a refill, no deductible. If you have a brand name drug, you may have a deductible that could be as high as $500, and then you'd have like a $47 copay per month for that prescription if it's a brand name drug that you have to get and you can't use the generic. And once your total drug costs hits $4,660 for the year, calendar year, meaning what you pay at the pharmacy plus what your Medicare plan pays, then you go into this thing called the coverage gap, also known as the donut hole. Maybe you've heard that term. Then the donut hole, when you're in that, you pay 25% of whatever the negotiated retail cost of the drug is. So if that drug is $100, you'd pay $25. And then once you've spent $7,400 of your own money on copays for the year, you leave the stage 3, you go into the catastrophic stage, where instead of 25%, you typically only pay 5%. And then on January 1st, it starts all over again. Every drug plan is structured very similar. The biggest difference with a standalone drug plan and an Advantage plan, the standalone drug plans typically have a $505 deductible this year for brand name drugs and specialty drugs. The Advantage plans, many of them, typically have a $0 deductible for all of your prescriptions. Pretty big savings. All of the drug plans have what's known as a formulary. It's just a fancy word for list of approved drugs. So they typically cover about 4,000 medications. They have to cover them in every category. And so a lot of times I will say to people, tell me what medications you take. Let's make sure that your Medicare plan covers your prescriptions. I mentioned that instead of an Advantage plan, everybody has the option instead of an Advantage plan to get a Medicare supplement. Why would people want a Medicare supplement instead of an Advantage plan? The biggest difference is with a Medicare supplement, There's no network requirement. It's not an HMO or PPO. You can go anywhere in the country. You could go to the Mayo Clinic. You could go to MD Anderson. You could go to Johns Hopkins. You're not limited or restricted by where you go. They're known as Medicare supplements or MedSup or Medigap. And that's because they're picking up the 20% that Medicare doesn't pay for. So they work together. When you go to the doctor, if you have a supplement policy, say with Blue Cross, as an example, you would give them your Medicare card, your supplement card, the doctor would bill Medicare. Medicare would pay the doctor 80% of the bill, and then the supplement would pay the doctor 20%. And you'd get a statement saying, Lee Green, you owe nothing. But that's why the supplements, because they cover 100%, they cost about $100 to $120 a month for a 65-year-old going on Medicare. The supplements do not cover dental, vision, hearing, over-the-counter debit cards, gym memberships. Typically, one of them does, but most of them don't. So you could add an additional dental and vision policy if you had a supplement. That might cost you anywhere from $30 to $60 a month, depending on what kind of dental and vision coverage you want. And again, these supplements or Medigap plans, they pick up the deductibles and the 20% that Medicare A and B doesn't cover. They do not include drug coverage, so you'd have to get a separate drug plan. And you can see any doctor anywhere in the country that accepts Medicare patients, which is 99% of all specialists and 100% of all hospitals. So when I talk to people, and if I go over the difference between a supplement and an advantage plan, and if I ask them, what's the most important thing to you? And if the first thing they say is, Lee, I want to be able to go to all my own doctors, and I want to be able to go to MD Anderson, God forbid I get cancer, then they need a Medigap or a Medicare supplement plan, because there's no network restrictions. If they say, you know what, Lee, all my doctors are at Baylor Scott and White, I'm in pretty good health. I love the dental and the vision and the hearing benefits. I love the monthly premium of $0, the free gym membership. I'm very comfortable going with the $0 premium Medicare Advantage plan. Everybody's different. I've been doing this 7 years. I have close to 2,000 clients, and would you believe that half of them have a Medigap plan, half of them have a Medicare Advantage plan? It's literally, it's split right down the middle. It's a very personal decision. So, what are the steps to proceed? The only thing that someone turning 65 has to do is to sign up for Part A and B. They can do that 3 months before they turn 65. Takes about 10 minutes. And then they simply need to add a Medicare supplement and drug plan or an Advantage plan. That's where I come into the picture. I help people figure out what's the best option for them based on their situation. And again, to sign up for Medicare A and B, if you're getting Social Security, you're automatically enrolled. They'll send you your card. If you're not getting Social Security yet, you just need to go on the Social Security website or go to the Social Security office near you and sign up for A and B. You can sign up 3 months before you turn 65, but again, it doesn't start until the month you turn 65. So if you turn 65 on July 10th, it'll start July 1st. And you have until 3 months after you turn 65 to sign up for Medicare. If you don't sign up during this 7-month window, 3 months prior, the month of your birthday, 3 months after, you may have a late enrollment penalty in the form of a higher premium if you put this off until later on in life. Very important that we discuss that. Okay, so there are some exceptions where you don't have to sign up for Medicare when you turn 65. The biggest exception is if you're still working and you have a really good employer plan. In that case, you don't have to sign up for Medicare until you retire. No penalty. Let's say you're still working. If your company has 20 or more employees, your employer plan is still primary. They pay first. And let's say your employer plan has no monthly premium. The company's paying for it, or maybe you're paying $50 a pay period or $50 a month, and you have really good coverage, a low deductible, et cetera. You may decide, I'm not going to sign up for Medicare now. I got a great employer plan. I intend to work till I'm 70. And why should I sign up for Medicare and pay $164.90 a month for Medicare when I have this great employer plan? I can save that $164 a month for 5 years. And so a lot of times people, they don't sign up for Medicare until they decide to retire. If your company has less than 20 employees, Medicare becomes primary at age 65, whether you're still working or not. So in that case, I advise most people to go ahead and sign up for Medicare A and B. So again, that's where I'm going to ask people when they call me up, hey, I'm turning 65. I'll say, are you still working? How are you covered today? Tell me about your employer plan. How much are they taking out of your paycheck every 2 weeks or every month? What kind of deductible do you have to meet when you go in the hospital? And based on that, I might say, you know, you have a great employer plan. No need for you to sign up for Medicare until you retire. Or if they say, you know, I'm paying $500 a month and I have a $5,000 deductible, I might say, you know, you might save a lot of money by going on a Medicare plan at age 65. So that really depends on your personal situation. And there's other times you can enroll in Medicare Advantage plans. Medicare has an open enrollment every year from October 15th till December 7th. You can switch your Advantage plan from one carrier to another. You can switch your drug plan. So there's a lot of movement that goes on, a lot of shopping during that October, November open enrollment. That's why you see a million TV commercials in the fall, because it's the Medicare open enrollment period. There are other times when you can sign up for Medicare Advantage plans, supplements, drug plans. If you're dropping employer coverage at any age. I get people call me up, I'm 68 years old, I'm retiring in July, I need Medicare. No problem, you can sign up, no penalty. You know, I'll tell you what you need to do to have Part A and B, and then I'll help you pick out your supplement or your Advantage plan. If you relocate, a lot of times when people retire, they say, hey, I'm moving to another city to be near my children and grandkids. That would create a special enrollment period where you might have 2 months in that new city to choose whatever Medicare plan you want with no questions asked. If you're in a low income situation, Social Security has a program called Extra Help with Prescription Drugs. That allows you to choose a new Medicare plan every quarter if you want. That's something I would go over with you. So the question is, do I need to sign up for the Medicare drug benefit? Again, if you have coverage through your employer plan and the drug benefit is at least as good as what Medicare offers, you don't have to, which is the case most of the time. It's known as a creditable drug benefit, meaning at least as good as Medicare. Then you do not have to sign up for a Part D drug plan until you decide to drop your employer coverage. No penalty. If you do not have a creditable drug benefit currently, and some people say, oh, I'll sign up for Medicare, but I don't take any medications, I don't need a drug plan. And then they call me up 5 years later, Lee, I'm taking 12 medications, I need a drug benefit. At that point, that person would have a late enrollment penalty based on how many months they went without a Medicare drug benefit. And that could be $10, $20, $50 a month extra that you'd have to pay every month for the rest of your life because you put it off. It's the same principle. You can't sign up for auto insurance after you've been in a wreck. It's not going to be reasonable. So Medicare does require that people sign up for a drug plan or at least have a drug benefit through their employer plan when they're 65. Otherwise, if they hold off, they might have what's called a late enrollment penalty. And I just mentioned that, the late enrollment penalty. The Medicare supplement plans, you know, if you sign up within 6 months of turning 65 and signing up for Medicare A and B, they're not allowed to ask you any health questions. You're automatically approved. You could be going through chemotherapy and you're covered day one. But if you do not have employer coverage, let's say you have a Medicare Advantage plan and 3 years later you decide you want to switch to a Medicare supplement, that supplement would be allowed to ask you about 30 health questions. And based on how you answer them, they have the right to accept you or reject you. That's a little complicated, but it's something that I would go over with you very carefully when you're considering what your Medicare options are. So if you sign up for a Medicare supplement when you turn 65, all your pre-existing conditions are covered, you're automatically approved. They can't charge you a higher premium just because you might have, heart disease or cancer or diabetes, and they can't delay the start of your coverage. And again, as I mentioned, if you delay enrollment in a supplement, after you've already had Medicare A and B for 6 months, or you basically have 2 months after you drop employer coverage to add a supplement with no pre-existing condition limitations. But if you decide to add a supplement 5 years after you've already been on Medicare, you might have to qualify for that. That's the open enrollment date, the 7 month. You have 7 months when you turn 65 to sign up for Medicare. You can also enroll in or change your Medicare plan during the annual enrollment period every fall. So that basically covers all of the main topics. Let me put my contact information up again. Again, since many of you are associated with employers that BKCW works with, if you're still working at age 65 and you have employer coverage and your company has 20 or more employees, you do not have to sign up for Medicare. You can do it later on, no penalty. If you are not contributing to a health savings account and you still want to keep your employer plan, you might just sign up for Part A only because it doesn't cost anything. And that gives you secondary coverage for a hospital bill. If you are contributing to an HSA, you really can't sign up for Medicare. Otherwise, you'd have a tax penalty. So if you want to sign up for Medicare, you have to stop contributing to your HSA at least 6 months prior to the date when you turn 65. These are just some of the nuances that come up when people turn 65 and they're trying to figure out, what do I do? I know there's a lot of options out there. It can be complicated. That's why it's a good idea to take 30 minutes or so, talk to a licensed Medicare insurance agent, tell them what your situation is and what you expect it to be when you turn 65. And then they can help you figure out what's the best option for you. I've been working with BKCW for about 4 years now. Be happy to talk to you or any of your employees when they turn 65, their spouses, etc., when they're trying to figure out what's the best option for me. So that's really the end of the presentation. Appreciate all of you signing in. And let me see if there's any questions in the chat box. I don't see any at this time. Let's take about 30 seconds. If you have a question, just type it in or unmute yourself. And feel free to let me know if you have a particular question that you want me to answer. Okay, I don't see anyone typing. So with that, Lori, I think we're going to end the recording. And if anybody has a question, feel free to give Lori or Tad a call or give me a call at my phone number, 512-373-0088. Be happy to help you. Thank you all, folks. Take care.